welcome back to Denver Wellness Digest. As always, Chris Perez here, bringing you information to hopefully make your lives better through mental health. Right now, I have joining us Tyler, and Tyler is a patient that was gracious enough to come on and share his experience with mental health, his journey through mental health, and his experience with ketamine. So I'd like to introduce him and kind of I'll ask him the questions and let him respond however he feels.
Sounds good.
Yeah, thanks, Tyler. Thanks for coming on. I'm really glad we got the opportunity to finally get this scheduled and get it recorded.
Happy to be here. I appreciate you inviting me.
Good, thank you. All right, so first of all, tell the audience a little bit about your journey through mental health treatment and the whole process.
Yeah, absolutely. So really started when I was about 20 years old. I got my first major depression episode, and I didn't really stop from there, unfortunately. I've had a lot of challenges along the way the past 6 or 7 years, just with constant down episodes. And I'm sure a lot of you can relate to this, but I've went through multitudes of different medication, different psychiatrists, different therapists, and nothing was really working at the time. And this past December, heading into January, I was really at a loss for what to do. I felt like I had tried everything in the book, stuck to my medication, kept going to therapy, but I just felt like it wasn't really enough, unfortunately. And I was getting desperate. I didn't know what the next step would be. I really thought that was all I could try. And my therapist told me about ketamine one day, and I had no idea what that was. All I've heard was it was just used for surgery, but I really looked into it, and it seemed like it was changing a lot of people's lives, and I was willing to really try whatever it took to get healthy again. So started talking to Chris Perez here and Sarah, definitely people that really care about you, which is not always the case in the mental health industry, and decided to go all in. Did 7 sessions actually, and by the time I was done, I really realized what I needed to do. It just gave me a lot more clarity. I felt a lot more connection with everything around me, and I'm definitely in a better place after all of these infusions. So would certainly recommend ketamine, but also the team Chris has, because they truly, genuinely care about you.
Thank you. Yeah, I remember when you first came, like your first couple visits, it's, we really kind of just felt a connection to you and really really wanted to make sure that you had a good outcome and that you benefited. And yeah. I remember talking with you and the challenges that you had experienced with some of the medications. I know you had some really negative side effects to some of them, really some abnormal side effects as well.
Yeah, not the common ones, unfortunately, but everyone knows there's quite a bit of potential side effects, and I'm just glad I didn't have any with ketamine, so it was great.
Yeah, I'm glad that worked well. Good. So tell me about your experience with the ketamine infusions.
Yeah, so like I mentioned previously, I did a lot of research just at home, really seeing how it impacted others and what types of experiences people have when they're under an infusion. So I walked in. Yeah, everyone was super inviting from the front desk to Chris. Really made me feel comfortable because I didn't know. I felt like it was going to be an uncomfortable experience, and I've never done anything like that in my life. So I was kind of going in with a blind eye, but they hooked me up with the IV, made me feel really comfortable before we actually started the infusions, and then I got my first one, my second one, third one. And what was really nice and what Chris did for me is he's really accommodating. He realized that my blood pressure is a little bit higher. I was a little more anxious, so he definitely supplemented me with other things that helped me calm down. And then as we continued upping the dose for me, it really started making an impact. I really started, seeing myself continuing to get better throughout the treatments, and with their guidance and their patience, I'm definitely in a better spot today than I was a few months ago. That's for sure.
I'm so glad to hear that. I know, you definitely are not a textbook patient, which, it's, you are kind of a very fast metabolizer, and you require a little bit more than what is the starting dose. And so what I'm really glad of is that, with my anesthesia background, I was really comfortable
absolutely
titrating you up to an appropriate dose that actually was effective for you.
Right.
Good. Well, tell us kind of like how things are going now.
Yeah, sure. So after the seventh infusion, I started feeling much better. And like I mentioned before, I realized really what I had to do. It wasn't just getting back on medication and continuing with the same lifestyle I had. I really took more of a holistic approach to my life. So I started getting out and socializing a lot more. I also changed my diet for the better. I'm actually vegetarian now, which I never thought would ever happen.
Yeah.
But that's been going really well. And then I'm exercising a lot more. Very consistent with that. So those three things, coupled by getting back on the right medicine regimen, and then of course just having a lot more clarity and again the connection that I feel with everybody at this moment. All those factors really playing into how much better I'm doing today than before I started the ketamine treatment back earlier this year.
I'm glad to hear that. And you said it in the perfect way. It's not going to fix you. It's going to help as a component of all these other changes. And one of the most important, one of the ones that we are continually trying to help encourage patients to do is to try and build more social connections. To really, we talk a ton about diet here. I'm so glad that you made whatever change was appropriate for you.
Right.
It seems to be working, and then exercise as well. So I couldn't be happier with the way that, you've really taken control of the situation and made changes that needed to be made and were really appropriate for you. So congratulations, man.
Appreciate it. Thank you. And your help and Sarah's help and front desk, everything's been incredible at your center. So couldn't thank you two enough. That's for sure.
Thank you.
Yeah.
Well, tell me, what's the future look like for you? What do you think?
Yeah, so I think just continuing what I'm doing right now at this moment. Again, continuing to socialize, lean on my family and friends more than I was previously. I really had kept it all in, which isn't healthy at all. Continuing therapy, continuing talking to Sarah, the psychiatrist, and then, the diet and exercise, and then just staying focused at my work. I think a lot of those things are really important, and getting out. I mean, I live in Colorado, so getting out to the mountains all year round is going to continue to be important for me. So overall, I think it's just being consistent with my current plan and my medication and just continuing to move forward.
Great. Do you have any advice for anybody that might be watching this that may be in a similar place to where you were, or, any words of encouragement?
Yeah, absolutely. So like I said, it started when I was 20, maybe earlier for some people, later for others. But I think the word is hope. I felt like I lost that, especially earlier this year. And, there are options out there. And I think what's really important is to continue to, include your family and friends in your journey. Also, continue to go to therapy if you have access to a therapist or psychiatrist. Certainly encourage keeping up with that. But again, with Alleviant and their center, I couldn't be happier with the experience, honestly. I mean, from just their continued follow-up, the actual ketamine infusion experience, it definitely blew me away with how professional and personalized it was to me. So again, there is a light at the end of the tunnel. I would suggest, giving your all, give ketamine a try if you have that option. It certainly changed my life around, that's for sure. But whatever you can do, just don't give up hope, and keep pushing forward.
I'm so glad you said that. I mean, we didn't even talk about this beforehand, but that really was the thing that we wanted the most for you was hope.
Right.
So kind of be able to give you that sense of hope and help you see that there is light at the end of the tunnel. And so, thank you for saying that. That's I think what so many people need to hear right now.
Right.
Great. Well, thank you so much. Hope to see you in the future here. I'm so glad we got a chance to connect on Zoom here and record this. And, reach out if you need anything.
I certainly will, Chris. I appreciate the time.
All right. Thanks, Tyler.
All right.